Hey, Paul, thank you. It is 6:24. If you suffer from allergies, it's been pretty miserable lately. We've been talking about all the smoky skies, not to mention the plants and everything that are starting to bloom and blossom. This is Dr. Christianson with Integrative Health. Thank you for coming on live with us this morning.
Thanks for having me, Nicole.
So when I heard that you could potentially cure yourself from having allergies, I said, sign me up. Tell us what this is all about.
It's a really cool thing. Basically, allergies are an error of the immune system. You're attacking something foreign that's not dangerous. And we've known for a long time that allergy shots can work for certain ages, certain numbers of allergens. Well, over the last several years, there's been a step up on the technology. And now that can be done without shots. You can do drops under the tongue, and they also can desensitize a fair number of allergies. And that's awesome. It can leave you to where you're no longer reactive. In future years, you don't have to do the sprays and the pills and everything else. You're just non-allergic.
That is fascinating, and you brought in some props to kind of show us what this is all about. But basically, you have folks come into your office, you run a blood test, and then you put together a specialized vial that basically they'll take a little spray under the tongue. And you said the results, some patients will see results immediately and start feeling relief, but what's the typical span for patients to start feeling totally desensitized?
We typically do some therapies to help short-term with their symptoms as we start the desensitizing. In most cases, within 1 to 2 months, we can document a real decrease in reactivity to their key allergens. So it's real allergens made up based upon their particular findings.
Oh, this is fascinating. So it's more or less like kind of a flu shot primer.
Yeah.
You're basically just introducing it in small doses, and then your body builds up an immunity, more or less.
That's a perfect analogy. You learn not to attack that substance, that it's not dangerous to your immune system.
And you can specialize these drops for me if I am allergic to dog hair and pollen, or my neighbor who might be allergic to something completely different.
And that's exactly how it works. The compounding is based upon your specific documented allergens, and then with retests, if there are remaining allergens, then it's targeting those particular ones.
Okay, so if I'm going to get relief within the first season off of potentially priming my immune system to this, would it be different? Do you have to go back the next season and kind of start it again just to be on the safe side?
You know, it depends how many and how severe the reactions are. For most people, you can get about half a dozen to 10 reactions pretty well cleared over the course of a year. And if that was someone's main allergies, they're in pretty good shape. They got smooth sailing afterwards.
I'm sure you guys are busy right now because it's tough with allergies.
It's a tough time for them, tough year.
Dr. Christianson, thank you so much for being live with us this morning. And we put a link if you'd like to learn more on our morning show webpage. Just go to cbs5az.com. You'll find the link to Dr. Christianson and his staff at Integrative Health. So we're going to take a quick break.